Good afternoon, all.
Person will feel comfortable in Rajasthan or with the same temperature 40 degree or in Bombay. Hmm? Same temperature at 40 degree centigrade. So person will feel comfortable in Rajasthan or coastal areas. How many are saying Rajasthan? और जो नहीं बोल रहा है वो explanation दे. Hmm. Same temperature है external environmental 40 degree centigrade. Okay. One is the coastal area. Okay. Another is desert area, dry heat है जहाँ पे. In humid environment, the body is um, losing electrolytes and fluid, okay, through sweat mechanism. But that sweat mechanism is not able to evaporate because there is always a humid condition. Whether if the setting or the evaporation does not take place, there will be no cooling effect. So the person will feel more comfortable in dry heat rather than in the humid conditions. Okay. And in dry heat, should a person wear full sleeves or not? अभी गर्मियाँ है ना? Okay. So should we go for full sleeves clothes or half sleeves or sleeveless or whatever? Hmm? Half sleeves. Hmm? कंफर्टेबल छोड़ दो, फिजियोलॉजी की बात करें अपन. Half. The body should be covered with cotton clothes. Okay, it should not get exposed because of the radiation. Okay, at least it should cover with some soft cotton material, but it should be covered. It should not be exposed. Okay, so coming back to the topic, increase, this is balance maintained. Okay, decrease blood pressure, blood volume and pressure. Endocrine response, increase ADH, aldosterone, RAS mechanism, opposite bodily response to above. This is water balance. Okay, this is normal. Okay, rising blood pressure and volume. Rising blood pressure और volume कब होगा? Rising blood pressure and volume कब होगा? Water loss होगा. Water content when there is increase in the loading, increase in the amount. Okay, so there will be increase in the pressure. Okay, so how the blood pressure or the water, so how they are connected. Okay, homeostasis gets disturbed, rising ECF volume. Okay, extracellular fluid volume by fluid gain or fluid and sodium gain, either plain water or gain along with sodium ion. What will happen? Increase in blood volume and distension. Okay, natriuretic peptide released by cardiac muscle cell. What it will do? It will increase the sodium loss in urine, increase water loss in urine, reduce thirst and inhibition of ADH and aldosterone. So this will be corrected. First story was general. Next comes sodium. Okay, along with sodium there is maintenance or regulation of fluid. Agar we are involving fluid, then it is going to affect the blood volume. When it is affecting blood volume, definitely it is going to affect blood pressure. When it is going to affect blood pressure, either the short-term regulatory mechanism will come into action or long-term regulatory mechanism will come into action. When we are talking of kidneys, okay, renal system, it is long-term regulatory mechanism, that is the renin, angiotensin, aldosterone mechanism, which will come into action and try to maintain homeostasis. Okay, so now what will happen in the reverse picture? if there is decrease in the blood volume. Decrease in the blood volume, what may be the causes? Dehydration, hemorrhage, blood loss, okay? So that will result into the decrease in blood volume. If there is decrease in blood volume, we have to restore the blood volume. So what that is done by? Increase renin secretion, aldosterone mechanism, okay, increase ADH release. So that will do the correction, increase urinary retention. When sodium is retention, then automatically water gets reabsorbed, okay. Decrease urinary water loss, increase thirst and increase water intake, and the correction is done. So if the regulation comes, okay, what effect does the inhibition of osmoreceptors or stimulation of osmoreceptor does? It is not always that the simple questions will be asked that write down the regulation, okay. It might be asked the effect of change in the fluid balance to osmoreceptors. रोल नंबर 104 किसका है? कोई ऐसा क्वेश्चन आता है पेपर में जिसमें डिस्कशन लिखा हो, डिस्कस एंड राइट? मैंने पहले भी पूछा था आप दोनों से, है ना? कोई ऐसा क्वेश्चन आता है जिसमें लिखा हुआ होता है डिस्कस एंड राइट? इट इज ओनली डिस्क्राइब, डिफाइन. इफ यू आर नॉट इंटरेस्टेड, आओ ही मत क्लास में. अगर आ गए हो तो थोड़ा सा पेशेंस डेवलप करो, एटलीस्ट 40 मिनट्स सुनने का. आउट ऑफ 40 मिनट्स ओनली 10 मिनट्स यू आर अटेंटिव, 30 मिनट्स ऑल ऑफ यू आर नॉट अटेंटिव, ओके. केवल इतना फोकस रहता है कि आपको एक कॉन्सेप्ट मिले इस टॉपिक का. दिस विल गो आउट ऑफ योर हेड व्हेन यू आर गोइंग टू रीड फॉर योर नेक्स्ट इंटरनल असेसमेंट. इट विल बी आउट ऑफ योर हेड. वाइवा में अगर पूछ लिया ना तो सब केवल हाँ हूँ करते रह जाएंगे, इससे आगे तीसरा शब्द नहीं निकलेगा आपके. है ना? अभी लग रहा है कितना सिंपल है, सेम चीज रिपीट हो रही है. Okay, potassium imbalance, another important ion, okay. Major gain is to GI tract, okay. Major loss is excretion by kidney, okay. Exchange of potassium is done with the help of which ion? Another ion which is responsible for exchange, sodium and another is hydrogen. So just remember, if there is variation in the potassium ion concentration, there will be variation in hydrogen ion concentration. When we are talking of hydrogen ion concentration, remember hydrogen ion concentration is responsible for pH. pH stands for potential hydrogen concentration. So just keep in mind when we are dealing with this potassium ion concentration, okay. Primary ECF potassium regulated by kidney since intake rarely is constant. Controlled by sodium potassium exchange pumps in DCT and collecting duct of nephron. Low ECF pH can cause hydrogen to be substituted for potassium. Highest in ICF due to sodium potassium exchange pump, approximately 135. And ECF may, please be specific, it is only approximately 5 milli equivalent. This is the story of potassium ions. What are the factors controlling potassium balance? Okay. What are the different sources of potassium? Okay. When we are ingesting food, what are the different constituents or components of food which is rich in potassium? Banana. So if the person is having hyperkalemia, is banana good? Potassium ion fluctuation directly affects the heart muscles, arrhythmias, okay. So if there is patient of heart failure, okay, having arrhythmias, so regular electrolyte test has to be performed, because potassium, calcium, they both have important role in muscle contraction. But if there is variation of potassium ion, it is going to result in the cardiac arrhythmia. So regular checkup along with the echo, the serum electrolyte balance has to be checked. ठीक है, लगता अपने को सिंपल है कि, और इसकी अप्रोक्सीमेटली ECF में कंसंट्रेशन इज ओनली 5 मिली इक्विवेलेंट. So what is the normal range, okay, to which the person can stand normally or physiologically, and if the variation exceeds, it results into hypo or hyperkalemia. Clear? Okay, this is potassium reabsorption. Ions are absorbed by the GI tract. The potassium ion concentration in the ECF is approximately 5 milli equivalent. The potassium ion concentration is approximately inside the cell is 135 milli equivalent. Just the opposite story of potassium की opposite story किसकी होगी, कौन से आयन की होगी? Okay, potassium concentration in ECF is relatively low. The rate of potassium entry from ICF through leaky channel is balanced by rate of potassium recovered by the sodium-potassium exchange pump. Okay, when potassium balance exists, the rate of urinary potassium excretion matches the rate of GI absorption. जितना GI absorption हो रहा है उसको match करते हुए potassium का excretion होगा. These are the different routes by which the potassium ion is regulated. Okay, primary mechanism of potassium. Disturbance of potassium balance, hypokalemia. Kalium means potassium below 2 milli equivalent. Average was 5 milli equivalent. So below 2 it is hypokalemia. Can be caused by diuretics. Okay, aldosterone, excess of aldosterone, so sodium potassium exchanger pump effect में आ रहा है. ठीक है, symptoms is muscular weakness followed by paralysis, potentially lethal when affecting heart. Clear? Potentially when it is affecting heart, and when it is hyponatremia when it is below 2 milli equivalent. Okay, disturbance hyperkalemia when it is above 8, can be caused by chronically low pH. Kidney failure, important route था kidney भी. Drugs promoting diuresis by blocking sodium potassium ATPase pump. Loop diuretics पढ़े थे जो अलग अलग mechanism पे act कर रहे थे. कुछ loop diuretics थे जो sodium potassium chloride pump को inhibit कर रहे थे, कुछ थे जो sodium potassium pump को कर रहे थे. So depending on the drug, if it is affecting sodium potassium pump, then it results in hyperkalemia. Okay. Symptoms muscular splash including heart arrhythmia. कितना टाइम हो गया? 45 हो गए? 55? कितना टाइम? 41 हुआ है. So another topic to be covered is acid base regulation. चलो, ये तो तुम पढ़े भी होगे थोड़ा बहुत, तो पढ़े हो ना? तो पूछो. Is there any difference between base and alkali? Is there any difference between base and alkali? Yes or no? क्या फिटजी और एलन सब वॉश आउट हो गया क्या? लास्ट रो. लास्ट. What do you mean by a base? बेस एसिड बेस होता है ना. बेस क्या होता है? pH more than 7. What do you mean by base? What are the substances which will be categorized as base? Hmm? OH, जो सब्सटेंस OH माइनस रिलीज करेंगे, पक्का? हम्म? और दूसरी डेफिनेशन? हम्म? क्या रोल नंबर है? 140? ओनली 45? और पीछे बैठ के जो ये नेटफ्लिक्स और ये सीरीज निपटाई जाती है ना मोबाइल के साथ में, बिकॉज यू ऑल आर फैमिलियर विद दीज टर्म्स ना, पीछे बहुत विस्परिंग होती है कुछ भी बताने की कोशिश करो तो। Okay, what are the substances they are classified as acids? मतलब किसी को अपन बोलते हैं ना कि एसिडिक नेचर का है. So what are the properties of a substance having acidic nature? Hmm? एसिड्स क्या सिक्रीट करते हैं, रिलीज करते हैं? H plus ion. Okay, so this release of hydrogen ion alone, okay, in the cells, in the body, they are secreted or released in nano quantities. They are released or secreted in nano quantities. But that nano quantity creates such a difference that it is responsible for having blood pH approximately 7.4. Because they are present in nano quantity, we take the negative logarithm of this hydrogen ion concentration. And that negative logarithm with Henderson equation, with the help of calculation and placing the constant values, okay, we get the value of pK, that is constant, and that is 6.1. So whatever the substances which are present in the body, okay, the buffers which we'll be talking in the next class, uski jiski bhi pKa value will be 6.1, that will be the most efficient buffer present in our body. Okay, so there are metabolic reactions taking place inside the cell. These metabolic reactions, they are mainly responsible for generating hydrogen ion or hydroxyl ion or changing the balance of bicarbonate ion. So either of these three may result into change in the pH. Change in the pH of blood, most important, and range of pH of blood is 7.35 to 7.42. Okay, and average is 7.4. So if there is decrease in the pH, the condition is known as acidemia or acidosis. If there is increase in the pH, alkalosis or alkemia. Okay, so depending in the change in the pH, the further studies or we'll do in the next class कि कौन से बफर प्रेजेंट होते हैं, बफर्स क्या होते हैं और वो किस तरह से रेगुलेट करते हैं. कुछ होते हैं शॉर्ट टर्म एंड फास्ट, कुछ होते हैं लॉन्ग टर्म एंड दे आर स्टेड फॉर लॉन्गर ड्यूरेशन. So that is another important topic, acidosis, alkalosis, respiratory and metabolic. Okay.